if you had to sit with the people that I've sat with over so many occasions who thought they had coverage, whose son got sick or whose mother broke a leg or something, and they literally have gone bankrupt or take on tens of thousands of dollars in medical debt and they get surprise bills. And then they read in the paper that their health insurer reported annual net income of over $20 billion. And I don't know how you guys feel, but I got to tell you, I'm a capitalist. I'm also compassionate, and I can no longer reconcile that. I really can't. There's a reason we're the only nation in the world that does it this way. I think it's time the way, by the way, from Roosevelt to Truman to Richard Nixon proposed universal health coverage, and it was Ted Kennedy that undermined it, if you can imagine that. If conservatives and progressives don't come to the table and talk about how we can deliver a national health insurance program that is portable, lets gig economy participants do their thing, that people don't have to make choices about where to work just because of the healthcare, I don't know why we wouldn't talk about that. And by the way, I'm not talking about the provision of care. It's really important because Fox News and some Republicans have tried to say this is a socialized solution, just the coverage, because the money is in the system already between 3, 4, 5, 6x pharma costs, between 2x health per capita health costs, 10,000 per person compared to any country in the world at 5. The answer is, I think, right there in front of us. The money's in the system, would not require a tax increase. I think we could actually save substantial money. I'm working on a proposition right now. I would argue that the model is part of the problem. Fee for service is antithetical to what we need. We need a capitated model that gives an incentive to the providers to
Totally
keep
agree.
people out of the hospital. At
Totally
least try. At least try. So that's the answer on that. And by the way, right now, Medicare, as you probably know, I think 23% of the country, or no, between Medicare and the VA, which are single payer systems, 25% of Americans right now are covered by a single payer system. And by the way, it works better than the other system.